If you're afraid of plastic surgery, but you still want to combat those signs of aging like crow's feet and marionette lines, there are some non-surgical things you can do. And here to talk about that is Dr. Craig Ingber. Good to see you, Dr. Ingber. That is exciting news. And I guess you're going to say you could probably do it on your lunch hour.
You actually can. There are many procedures we perform. You could come in during lunch, go back to work, and tell you the truth, most women do. There's very little downtime with anything we do.
As we know about Restylane and Juvederm and Botox, anything else out there that looks promising and exciting?
Several new dermal fillers like Restylane and Juvederm. However, I think they're still the best and the ones we use the most because A, they're reversible, B, they're natural products. It's more in the application of those two products and where you put them. When they first came out, the FDA approved them only for the smile lines, and now we use them all over the face and other places. So you can correct bags under the eyes, you can do nose jobs, you can fill in cheeks, temples, jaw lines, a lot of applications that weren't done 2 years ago.
Why would we go to you, a plastic surgeon, versus a dermatologist or anybody else?
My brother's a dentist in Philadelphia, and he is injecting Botox and Restylane. But correctly, you should go to a plastic surgeon or a dermatologist. Plastic surgeons, I think, are best equipped because they know the facial anatomy from doing surgery. They know where the blood vessels are, they know every muscle, they know every nerve, and they know what it should look like naturally.
There's so many celebrities out there, Dr. Ingber, and they have the money to afford a good plastic surgeon, and they just end up looking scary looking. What's happening?
You have two problems. You have a patient who has an incorrect idea of what they should look like or what beauty is, and then you have a surgeon or a dermatologist who is willing to do it merely because it is a celebrity. I would never do that. We have sent people out of my office who wanted lips that look like duck lips. I won't do that.
You're conveniently located next to something that you love.
We're about 200 yards down the street from the Paseo Tennis Club, and I'm there 4 or 5 days a week playing. I love it. You do have the problem of sunshine, so I wear a good sunscreen, and I wear a vitamin C serum too, which protects you from the sun, and a hat.
Now, what are you looking for when someone comes in and they're outside a lot and it ages their skin, I guess, faster than if they're not? Right. What are you looking for when someone comes in? What are the signs of aging?
In a word, shadows. When you have deep folds, like the nasolabial folds, or you've lost some volume here and get dark circles under the eyes, what you're actually seeing is shadows from light being trapped in these areas. So what we want to do is get rid of the shadows. Even wrinkles show because of shadows. If you shine enough light on them, then you can get rid of those shadows. And by filling those areas with dermal filler or getting rid of the wrinkle itself by using Botox or Dysport, you've gotten rid of the shadow. The idea is mainly to restore the patient to what they looked like maybe 10 years ago. You don't want to do anything abnormal or change their appearance greatly. Just want to lift things back up and smooth things out for more.
As you get older, things get bigger, like your nose and your ears. Is that true?
The ears definitely get bigger. By the way, we can actually correct earlobes with Restylane or Juvederm. The nose is one of my favorite things to do. Not that it necessarily gets bigger, but it will droop because of gravity. The nose will turn down. And because I've done over 5,000 rhinoplasties in my life, I think I'm particularly adept at correcting the nose with Restylane.
And the nose jobs, that's a lot of downtime.
Typical nose job, you actually get your best look around 6 months after the surgery. With what we're doing with Restylane, you can not only go back to work, you could conceivably go to your wedding that night.
It's unbelievable.
Yeah.
And why are these injectables temporary?
They're temporary because the ones we use, Restylane and Juvederm, are hyaluronic acid, which is a natural part of skin and collagen. There are many products that have foreign bodies in them that produce scarring that is supposed to last longer or be more permanent. They're not, but you run the risk of not being able to control that scarring. With Restylane and Juvederm, I can control every millimeter of what I do. So that's why I stick with those products.
What sets you apart from your competition?
Well, I'd have to say, number one, I am a facial plastic surgeon. Number two, the things we're talking about is what I do all day long. There are lots of plastic surgeons and dermatologists who have very busy practices who on the side will do fillers and Botox and lasers. I don't do surgery anymore. All I do all day long is inject, and my nurse and I do lasers. We incredibly specialize in this, and in LA County, probably I inject more than any single physician. Fillers require a certain amount of artistry, and you have to have an eye for it.
Safety first.
Yeah, safety first, and that's why I do all the injections, and I set all the settings on the lasers that my nurse does.
Well, good luck, continued success, and thank
Thank
you
you.
so much.
Okay.
Enjoyed our visit. Very educational.
Thank you.